Hi guys! I'm sure that none of you have missed the ongoing pandemic that's sweeping the world. But what do we know about how Covid-19, the new coronavirus, affects our children? This week on Momology, we'll go through the spread, the most common symptoms, and the treatment for our kids. And also what this can mean for those of you who are pregnant during this time. So coronaviruses are a group of zoonotic viruses, which means that they can spread between people and animals. They are called corona because of their crown-like appearance, if you look at their structure using an electron microscope. As you probably know, the most common symptoms are a fever, coughing, but you can also experience gastrointestinal symptoms, muscle aches, and a shortness of breath. Some people even experience a loss of taste or smell. And a report in The Lancet has reported that acute respiratory distress is the main cause of death in COVID patients. In contrast to initial reports, children are just as likely as adults to have the coronavirus, but they usually have milder symptoms. While the reasons for this are unknown, some suggestions are that children have a more active innate immune response, that they have healthier respiratory tracts, and that they have fewer underlying disorders. So while children have milder symptoms, they still play a role in spreading the virus. And virus shedding has been found in the nose and even in the poop of children up to 30 days after diagnosis. The incubation period, so the time between in which you are infected and that you develop symptoms, can be anything between 2 and 25 days in children. The average is about 7 days. In a paper reviewing 38 studies on the coronavirus in children, they found that up to 14% of children are asymptomatic, so they have no symptoms at all. 36% of children with the coronavirus had mild symptoms, 46% had moderate symptoms, 2.5% had severe symptoms, and 1.2% were critical. The most common symptoms in children are a fever and/or a cough, which are reported in about 48% of the cases. 11% of children present with nasal symptoms, so a runny nose or a stuffy nose, for example. About 8% of the children have diarrhea, and around 7% feel nauseous or vomit. 5% of children report that they are fatigued, and around 3% have respiratory issues. The loss of the sense of smell, which can be reported for adults, wasn't described at all in these studies looking at children. Of children who were admitted to the hospital, around 10% were diagnosed with pneumonia, and other common clinical signs were a red throat and increased breathing and heart rate. Of those children who needed to seek medical attention and received a CT scan, they saw lung abnormalities in about 63% of the children, and up to 79% of children had another infection ongoing, such as mycoplasma or influenza. With that said, children with corona rarely need to seek admission to the hospital, and only around 3% need intensive care. Furthermore, only a small number of deaths in children have been reported worldwide. As for the long-term effects of COVID-19, we just don't know yet. So what about pregnancy? In a paper reviewing 9 small case studies in pregnant women, which included around 65 women, only 3% of mothers needed to be admitted to intensive care. Though the coronavirus hasn't been isolated from amniotic fluid, the placenta, vaginal swabs, cord blood, breast milk, or swabs from the nose or throat of the newborns, some newborns have still tested positive despite strict infection and prevention control. Therefore, we haven't been able to completely rule out vertical transmission. So vertical transmission is the passage of a disease-causing agent from the mother to the baby. And this can happen immediately before, during, or after birth. So for example, across the placenta, through the breast milk, or via direct contact. In some rare cases, babies whose mothers had corona during pregnancy have tested positive for antibodies of coronavirus at birth. However, WHO, the World Health Organization, does not believe that human breast milk is a vehicle for COVID-19, and they believe that mothers can breastfeed if they wish to do so. So what about treatment strategies? There are a lot of ongoing studies about treatment strategies for COVID-19. However, most of these are in adults. And as for other diseases and disorders, you usually use the same treatment as for adults, but modified for children. So future studies on this is needed. But like I said before, most children have very mild symptoms and aren't in need of treatment. So that was it for now on COVID-19 in children. So until next time, stay safe out there, remember to wash your hands, and I'll see you next time. Don't forget to like and subscribe and leave your comments below. Bye guys.